Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Tirzepatide for metabolic dysfunction associated steatohepatitis with liver fibrosis. Background. Metabolic dysfunction associated steatohepatitis, MASH, is a progressive liver disease associated with liver-related complications and death. The efficacy and safety of tirzepatide, an agonist of the glucose-dependent insulinotropic polypeptide and glucagon-like peptide 1 receptors, in patients with MASH and moderate or severe fibrosis, is unclear. Methods. We conducted a Phase 2, dose-finding, multicenter, double-blind, randomized, placebo-controlled trial involving participants with biopsy-confirmed MASH and stage F2 or F3, moderate or severe, fibrosis. Participants were randomly assigned to receive once-weekly subcutaneous tirzepatide, 5 mg, 10 mg, or 15 mg, or placebo, for 52 weeks. The primary endpoint was resolution of MASH without worsening of fibrosis. At 52 weeks, a key secondary endpoint was an improvement, decrease, of at least one fibrosis stage without worsening of MASH. Results. Among 190 participants who had undergone randomization, 157 had liver biopsy results at week 52 that could be evaluated, with missing values imputed under the assumption that they would follow the pattern of results in the placebo group. The percentage of participants who met the criteria for resolution of MASH without worsening of fibrosis was 10% in the placebo group, 44% in the 5 mg tirzepatide group. Difference versus placebo, 34 percentage points, 95% confidence interval, CI, 17 to 50, 56% in the 10 mg tirzepatide group. Difference, 46 percentage points, 95% CI, 29 to 62, and 62% in the 15 mg tirzepatide group. Difference, 53 percentage points, 95% CI, 37 to 69, p less than 0.001 for all three comparisons. The percentage of participants who had an improvement of at least one fibrosis stage without worsening of MASH was 30% in the placebo group, 55% in the 5 mg tirzepatide group. Difference versus placebo, 25 percentage points, 95% CI, 5 to 46, 51% in the 10 mg tirzepatide group. Difference, 22 percentage points, 95% CI, 1 to 42, and 51% in the 15 mg tirzepatide group. Difference, 21 percentage points, 95% CI, 1 to 42. The most common adverse events in the tirzepatide groups were gastrointestinal events, and most were mild or moderate in severity. Conclusions. In this Phase 2 trial involving participants with MASH and moderate or severe fibrosis, treatment with tirzepatide for 52 weeks was more effective than placebo with respect to resolution of MASH without worsening of fibrosis. Larger and longer trials are needed to further assess the efficacy and safety of tirzepatide for the treatment of MASH. Blinatumomab for MRD-negative acute lymphoblastic leukemia in adults. Background. Many older adults with B-cell precursor acute lymphoblastic leukemia, BCPL, have a relapse despite having a measurable residual disease, MRD-negative complete remission, with combination chemotherapy. The addition of blinatumomab, a bispecific T-cell engager molecule that is approved for the treatment of relapsed, refractory, and MRD-positive BCPL, may have efficacy in patients with MRD-negative remission. Methods. In a Phase 3 trial, we randomly assigned patients 30 to 70 years of age with BCR-ABL1 negative BCPL, with, indicating fusion, who had MRD-negative remission, defined as less than 0.01% leukemic cells in bone marrow, as assessed on flow cytometry, after induction and intensification chemotherapy to SAT. Receive 4 cycles of Blinatumomab, in addition to 4 cycles of consolidation chemotherapy, or to receive 4 cycles of consolidation chemotherapy alone. The primary endpoint was overall survival, and relapse-free survival was a secondary endpoint. Results. The Data and Safety Monitoring Committee reviewed the results from the third efficacy interim analysis and recommended that they be reported. Complete remission, with or without full count recovery, was observed in 395 of 488 enrolled patients, 81%. Of the 224 patients with MRD-negative status, 112 were assigned to each group. The characteristics of the patients were balanced between the groups. At a median follow-up of 43 months, an advantage was observed in the Blinatumomab group, as compared with the chemotherapy-only group, with regard to overall survival. At 3 years, 85% versus 68%, hazard ratio for death, 0.41, 95% confidence interval, CI, 0.23 to 0.73, p equals 0.002. And the 3-year relapse-free survival was 80% with Blinatumomab and 64% with chemotherapy alone. Hazard ratio for relapse or death, 0.53, 95% CI, 0.32 to 0.87. A higher incidence of neuropsychiatric events was reported in the Blinatumomab group than in the chemotherapy-only group. Conclusions. The addition of Blinatumomab to consolidation chemotherapy in adult patients in MRD-negative remission from BCP all significantly improved overall survival. Next, we will be discussing articles from Journal of American Medical Association. Association between cost sharing and Naloxone prescription dispensing. Importance increasing access to Naloxone, an opioid antagonist that can reverse overdose, could slow the U.S. opioid epidemic. Prior studies suggest cost sharing may be a barrier to dispensing of Naloxone prescriptions. But these studies were limited by their cross-sectional designs and use of databases that do not capture prescriptions that are not filled, abandoned. Objective: to evaluate the association between cost sharing and Naloxone prescription abandonment, non-dispensing of Naloxone prescriptions. Conclusions: the elimination of cost sharing might be associated with increased Naloxone dispensing to commercially insured and Medicare patients. Next, we will be discussing articles from Annals of Internal Medicine. Effect of acupuncture for methadone reduction, a randomized clinical trial. Background: methadone maintenance treatment, MMT, is effective for managing opioid use disorder, but adverse effects mean that optimal therapy occurs with the lowest dose that controls opioid craving. Objective: to assess the efficacy of acupuncture versus sham acupuncture on methadone dose reduction. Conclusion: 8 weeks of acupuncture were superior to sham acupuncture in reducing methadone dose and decreasing opioid craving. Next, we will be discussing articles from British Medical Journal. Effectiveness of behavioural interventions with motivational interviewing on physical activity outcomes. Objective: to evaluate the effectiveness of behavioral interventions that include motivational interviewing on physical activity outcomes in adults. Design systematic review and meta-analysis. Study selection A. Search of 7 databases for randomized controlled trials, published from inception to March 1, 2023, comparing a behavioral A.I.F. intervention including motivational interviewing with a comparator, without motivational interviewing on physical activity outcomes in adults. Outcomes of interest were differences in change in quantitative measures of total physical activity, moderate to vigorous physical activity, MVPA, and sedentary time. Conclusions: certainty of the evidence using motivational interviewing as part of complex behavioral interventions for promoting total physical activity in adults was low, and for MVPA and sedentary time was very low. The totality of evidence suggests that, although interventions with motivational interviewing increase physical activity, and decrease sedentary behavior, no difference was found in studies where the effect of motivational interviewing could be isolated. Effectiveness waned over time, with no evidence of a benefit of motivational interviewing to increase physical activity beyond 1 year. Next, we will be discussing articles from Lancet. Effectiveness and cost-effectiveness of an individualized, progressive walking and education intervention for the prevention of low back pain recurrence in Australia, WalkBack, a randomized controlled trial. Background: recurrence of low back pain is common and a substantial contributor to the disease and economic burden of low back pain. Exercise is recommended to prevent recurrence, but the effectiveness and cost-effectiveness of an accessible and low-cost intervention, such as walking, is yet to be established. We aimed to investigate the clinical effectiveness and cost-effectiveness of an individualized, progressive walking and education intervention to prevent the recurrence of low back pain. Interpretation: an individualized, progressive walking and education intervention significantly reduced low back pain recurrence. This accessible, scalable, and safe intervention could affect how low back pain is managed. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Journal of Clinical Oncology. Contact 01, a randomized phase 3 trial of atezolizumab plus cabozantinib versus docetaxel for metastatic non-small cell lung cancer after a checkpoint inhibitor and chemotherapy. Purpose: although checkpoint inhibitors have improved first-line treatment for non-small cell lung cancer, NSCLC, a therapeutic need remains for patients whose disease does not respond or who experience disease progression after anti-PD-L1 PD-1 immunotherapy. Contact 01 evaluated atezolizumab plus cabozantinib versus docetaxel in patients with metastatic NSCLC who developed disease progression after concurrent or sequential treatment with anti-PD-L1 PD-1 and platinum-containing chemotherapy. Methods: this multi-center, open-label, phase 3 trial randomly assigned patients, 1:1, to atezolizumab 1,200 mg intravenously once every 3 weeks, Cu, plus cabozantinib 40 mg, orally once daily, or docetaxel 75 mg/m2, intravenously once every 3 weeks. The primary endpoint was overall survival, OS. Conclusion: atezolizumab plus cabozantinib after disease progression following anti-PD-L1 PD-1 immunotherapy and platinum-containing chemotherapy for metastatic NSCLC did not improve OS compared with docetaxel. Safety was consistent with known profiles of these agents. Purpose: therapy-related myeloid neoplasm, TMN, is a life-threatening complication of autologous peripheral blood stem cell transplantation, ABF-STET, for Hodgkin lymphoma, HL. Although previous studies have reported an association between clonal hematopoiesis, CH, in the infused PBSC product and subsequent post-ABDBS risk of TMN in patients with non-HL, information about patients with HL treated with Acupuncture is not available. Methods: we constructed a retrospective cohort of 321 patients with HL transplanted at a median age of 34 years, range 18 to 71. Targeted DNA sequencing of PBSC products performed for CH-associated or myeloid malignancy-associated genes, identified pathogenic mutations in these patients. Conclusion: the presence of TP53 and/or PPM1D mutations in the PBSC product increases the risk of post-ABDBS TMN and non-relapse mortality among patients with HL, and may support alternative therapeutic strategies. Here are the articles from Journal of Hepatology. Sex and ethnic disparities in hepatitis B evaluation and treatment across the world. Among 12,566 patients with chronic HBV infection, about 1/4 were not adequately evaluated. Among adequately evaluated patients, About 1/3 were treatment eligible by international guidelines. Among those who were treatment eligible, about 80 to 85% were treated. Treatment rates were lower in females and Asian Americans versus Asians from the East or non-Asians. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Clinical Gastroenterology. Association between celiac disease and irritable bowel syndrome, a nationwide cohort study. Background and aims. The aim of this study was to determine the risk of irritable bowel syndrome, IBS, diagnosis in patients with celiac disease, CD, compared with general population comparators. Methods. Using Swedish histopathology and register-based data, we identified 27,262 patients with CD diagnosed in 2002 to 2017, and 132,922 age and sex matched general population comparators. Diagnoses of IBS were obtained from nationwide inpatient and non-primary outpatient records. Cox regression estimated hazard ratios, Rs, for IBS adjusted for education level, and Charlson Comorbidity Index. To reduce potential surveillance bias, our analyses considered incident IBS diagnosis greater than or equal to 1 year after CD diagnosis. Using conditional logistic regression, secondary analyses were calculated to estimate odds ratios, ORs, for IBS diagnosis greater than or equal to 1 year before CD diagnosis. Conclusions. In patients with CD, the risk of IBS is increased long before and after diagnosis. Clinicians should be aware of these long-term associations and their implications on patient management. Long-term effectiveness and durability of COVID-19 vaccination among patients with inflammatory bowel disease. Background and aims. COVID-19 vaccination prevents severe disease in most patients with inflammatory bowel disease, IBD, but immunosuppressive medications can blunt serologic response. We followed adults with IBD for greater than 1 year post-COVID-19 vaccination to describe factors associated with SARS-CoV-2 infection after vaccination, evaluate for a protective SARS-CoV-2 antibody level, characterize SARS-CoV-2 antibody persistence, and identify factors associated with humoral immune response durability. Methods. Using a prospective cohort of COVID-19 immunized adults with IBD, we analyzed factors associated with SARS-CoV-2 infection after vaccination. We evaluated for an association between SARS-CoV-2 antibody level 12 weeks post-vaccination and subsequent SARS-CoV-2 infection and assessed for a threshold of protection using receiver operating characteristic curve analysis. We then conducted a separate analysis, evaluating factors associated with persistence of SARS-CoV-2 antibodies 52 weeks post-immunization. Conclusions. COVID-19 vaccination generates an effective and durable protective response for the vast majority of adults with IBD, including vulnerable populations such as corticosteroid users and older individuals. Patients with IBD benefit from COVID-19 booster vaccination. Low colorectal cancer risk after resection of high-risk pedunculated polyps. Background. Post-fecal immunochemical test, FIT, colonoscopy, represents a setting with an enriched prevalence of advanced adenomas. Due to an expected higher risk of colorectal cancer, CRC, post-polypectomy surveillance is recommended, generating a substantially increased load on endoscopy services. The aim of our study was to investigate post-polypectomy CRC risk in a screening population of FIT plus subjects after resection of low-risk adenomas, LRAs, or high-risk adenomas, HRAs. Methods. We retrieved data from a cohort of patients undergoing post-polypectomy surveillance within a FIT-based CRC screening program in Italy between 2002 and 2017, and followed up to December 2021. Main outcomes were post-polypectomy CRC incidence and mortality risks, according to type of adenoma, LRA/HRA, removed at colonoscopy, as well as morphology, size, dysplasia, and location of the index lesion. We adopted as comparators FIT plus/colonoscopy negative and FIT patients. The absolute risk was calculated as the number of incident CRCs per 100,000 person-years of follow-up. We used Cox multivariable regression models to identify associations between CRC risks and patient and polyp-related variables. Conclusions: CRC incidence is significantly higher in patients with HRAs diagnosed at colonoscopy. However, such excess risk does not appear to apply to patients with only distal pedunculated polyps without high-grade dysplasia, an observation that could potentially reduce the burden of surveillance in FIT program. Next, we will be discussing articles in the field of infectious diseases. Here are the articles from Clinical Infectious Diseases. Excellence in Antibiotic Stewardship, a mixed methods study comparing high, medium, and low-performing hospitals. Background: despite antibiotic stewardship programs existing in most acute care hospitals, there continues to be variation in appropriate antibiotic use. While existing research examines individual prescriber behavior, contextual reasons for variation are poorly understood. Methods: we conducted an explanatory, sequential mixed methods study of a purposeful sample of 7 hospitals with varying discharge antibiotic overuse. For each hospital, we conducted surveys, document analysis, and semi-structured interviews with antibiotic stewardship and clinical stakeholders. Data were analyzed separately and mixed during the interpretation phase, where each hospital was examined as a case, with findings organized across cases using a strengths, weaknesses, opportunities, and threats framework to identify factors accounting for differences in antibiotic overuse across hospitals. Conclusions: this mixed methods study demonstrates the importance of organizational context for high performance in stewardship, and suggests that improving antimicrobial stewardship requires attention to knowledge, interactions, and relationships between clinical teams and infrastructure that supports stewardship and team interactions. Next, we will be discussing articles in the field of rheumatology. Here are the articles from Journal of Clinical Rheumatology. Causality Assessment between Idiopathic Inflammatory Myopathies and Lung Cancer, a bidirectional 2-sample Mendelian randomization. Background: although observational studies have revealed associations between idiopathic inflammatory myopathies, IMS, and lung cancer, LC, they have not established a causal relationship between these two conditions. Methods: we used a 2-sample Mendelian randomization approach to examine the bidirectional causal associations between AMS and LC, using single nucleotide polymorphisms selected from high-quality genome-wide association studies in the FinGen database. Sensitivity analyses were conducted to assess potential heterogeneity and pleiotropy impacts on the Mendelian randomization results. Conclusion: our findings offer compelling evidence of a positive causal relationship between AMs and LC, particularly with regard to lung squamous cell carcinoma in the European population. Conversely, there is no evidence of LC causing AMS. We recommend that LC diagnosis consider the specific characteristics of AMS. Here are the articles from Arthritis and Rheumatology. Effect of intravenous zoledronic acid on total knee replacement in patients with symptomatic knee osteoarthritis and without severe joint space narrowing. Objective: to determine the effect of zoledronic acid, ZA, on the risk of total knee replacement, TKR, in patients with symptomatic knee osteoarthritis and without severe joint space narrowing, JSN. Methods: we included 222 participants, mean age 62 years, 52% female, from the 2-year zoledronic acid for osteoarthritis knee pain trial. 113 received 5 mg of ZA annually, and 109 received placebo, conducted between November 2013 and October 2017. Primary TKR were identified until February 22, 2022. The effect of ZA on TKR risk was evaluated using Cox proportional hazard regression models. Because the treatment effect failed the proportional hazards assumption, A time-varying coefficients analysis for treatment was conducted by splitting the study into 2 periods, within and after 2 years of randomization. Conclusion. These results suggest that ZA is not protective against TKR in patients with symptomatic knee osteoarthritis and without severe JSN. Next, we will be discussing articles in the field of cardiology. Here are the articles from journals of the American College of Cardiology. Impact of anatomical and viability, guided completeness of revascularization on clinical outcomes in ischemic cardiomyopathy. Background. Complete revascularization of coronary artery disease has been linked to improved outcomes in patients with preserved left ventricular LV function. Objectives. This study sought to identify the impact of complete revascularization in patients with severe LV dysfunction. Methods. Patients enrolled in the revived BCIS-2, revascularization for ischemic ventricular dysfunction, trial were eligible if baseline/procedural angiograms and viability studies were available for analysis by independent core laboratories. Anatomical and viability-guided completeness of revascularization were measured by the coronary and myocardial revascularization indices, RECORO and RIMIO, respectively, where RECORO equals change in British Cardiovascular Intervention Society Jeopardy score, BSES-JS. Baseline BSES-JS, and RIMO equals number of revascularized viable segments. Number of viable segments supplied by diseased vessels. The percutaneous coronary intervention, PCI, group was classified as having complete or incomplete revascularization by median RECORO and RIMIO. The primary outcome was death or hospitalization for heart failure. Conclusions. In patients with severe LV dysfunction, neither complete anatomical nor viability-guided revascularization was associated with improved event-free survival, compared with incomplete revascularization or treatment with medical therapy alone. Racial differences in diabetic cardiomyopathy, the ARISE-HF trial. Background. Diabetic cardiomyopathy, DBCM, increases risk of overt heart failure in individuals with diabetes mellitus. Racial and ethnic differences in DBCM remain unexplored. Objectives. The authors sought to identify racial and ethnic differences among individuals with type 2 diabetes mellitus, structural heart disease, and impaired exercise capacity. Methods. The ARISE-HF, aldolase reductase inhibitor for stabilization of exercise capacity and heart failure, trial is assessing the efficacy of an aldose reductase inhibitor for exercise capacity preservation in 691 persons with DBCM. Baseline characteristics, echocardiographic parameters, and functional capacity were analyzed and stratified by race and ethnicity. Conclusions. Racial and ethnic differences exist in baseline characteristics of persons affected by DBCM, with Black and Hispanic study participants demonstrating higher risk features. These insights inform the need to address differences in the population with DBCM. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Depressive syndromes in men with hypogonadism in the TRAVERSE trial, response to testosterone replacement therapy. Context. The effect of testosterone on depressive symptoms in men with hypogonadism remains incompletely understood. Objective. We assessed the effects of testosterone replacement therapy, TRT, in improving depressive symptoms in hypogonadal men with and without depressive symptoms enrolled in the TRAVERSE cardiovascular safety trial. Methods. A randomized, placebo-controlled, double-blind study was conducted at 316 trial sites. Participants included men, aged 45 to 80 years, with 2 fasting testosterone levels less than 300 nanograms/dl. 1 or more hypogonadal symptoms, cardiovascular disease, CVD, or increased risk of CVD. We evaluated 3 subgroups of participants. 1. Men with rigorously defined, late life onset, low-grade persistent depressive disorder, LGPDD, previously dysthymia. 2. All men with significant depressive symptoms, patient health questionnaire 9 score greater than 4, and 3. All randomly assigned men. Intervention included 1.62% transdermal testosterone or placebo gel. Outcome measures included the proportions of participants: 1. Meeting criteria for LGPDD, or 2. With significant depressive symptoms, and changes in depressive symptoms, energy, sleep quality, and cognition in testosterone-treated versus placebo-treated men in the 3 subgroups. Conclusion: depressive symptoms are common in middle-aged and older men with hypogonadism, but LGPDD is uncommon. TRT is associated with small improvements in mood and energy in hypogonadal men with and without significant depressive symptoms. Next, we will be discussing articles in the field of neurology. Here are the articles from neurology. Functional outcome and hemorrhage rates after bridging therapy with tenecteplase or alteplase in patients with large ischemic core. Background and objectives. For tenecteplase is an alternative to alteplase before mechanical thrombectomy. Mount, in patients with large vessel occlusion, LVO, ischemic stroke. Little data are available on its use in patients with large ischemic core. We aimed to compare the efficacy and safety of both thrombolytics in this population. Methods. We conducted a retrospective analysis of patients with anterior circulation LVO strokes and diffusion weight, imaging Alberta Stroke Program early CT score, DWI aspects, less than or equal to 5 treated with tenecteplase or alteplase before mount from the tetris. Tenecteplase and ETs, alteplase, French multicenter registries. Primary outcome was reduced disability at 3 months. Ordinal analysis of the modified Rankin scale, misses. Safety outcomes were 3-month mortality, parenchymal hematoma, PH, and symptomatic intracranial hemorrhage, psych-CH. We used propensity score overlap weighting to reduce baseline differences between treatment groups. Discussion. Our data are encouraging regarding the efficacy and reassuring regarding the safety of tenecteplase compared with that of alteplase in bridging therapy for patients with LVO strokes and a large ischemic core in routine clinical care. These results support its consideration as an alternative to alteplase in bridging therapy for patients with large ischemic cores. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. Anaerobic antibiotic coverage in aspiration pneumonia and the associated benefits and harms. A retrospective cohort study. Background. Antibiotics with extended anaerobic coverage are used commonly to treat aspiration pneumonia, which is not recommended by current guidelines. Research question. In patients admitted to hospital for community-acquired aspiration pneumonia, does a difference exist between antibiotic therapy with limited anaerobic coverage, LAC, versus antibiotic therapy with extended anaerobic coverage, EAC, in terms of in-hospital mortality and risk of Clostridioides difficile colitis? Study design and methods. We conducted a multi-center retrospective cohort study across 18 hospitals in Ontario, Canada, from January 1, 2015, to January 1, 2022. Patients were included if the physician diagnosed aspiration pneumonia and prescribed guideline concordant first-line community-acquired pneumonia, parenteral antibiotic therapy to the patient within 48 hours of admission. Patients then were categorized into the LAC group if they received ceftriaxone, cefotaximins, or levofloxacin. Patients were categorized into the EAC group if they received amoxicillin clavulanate, moxifloxacin, or any of ceftriaxone, cefotaxime, or levofloxacin, in combination with clindamycin or metronidazole. The primary outcome was all-cause in-hospital mortality. Secondary outcomes included incident C. difficile colitis occurring after admission. Overlap weighting of propensity scores was used to balance baseline prognostic factors. Interpretation. We found that extended anaerobic coverage likely is unnecessary in aspiration pneumonia because it was associated with no additional mortality benefit, only an increased risk of C. difficile colitis. Achieving Goals of Care Decisions in Chronic Critical Illness, a multi-institutional qualitative study. Background. Physicians, patients, and families alike perceive a need to improve how goals of care, GOC, decisions occur in chronic critical illness, CCI, but little is currently known about this decision-making process. Research question. How do intensivists from various health systems facilitate decision-making about GOI for patients with CCI? What are barriers to, and facilitators of, this decision-making process? Study design and methods. We conducted semi-structured interviews with a purposeful sample of intensivists from the United States and Canada, using a mental models approach adapted from decision science. We analyzed transcripts inductively, using qualitative description. Interpretation. Intensivists described a complex time and labor-intensive group process to achieve GOC decision-making in CCI. System-level interventions that improve how information is shared between physicians and decrease logistical and relational barriers to timely and consistent communication are key to improving GOC decision-making in CCI. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Rationale. The airway microbiome has the potential to shape chronic obstructive pulmonary disease, COPD, pathogenesis, but its relationship to outcomes in milder disease is unestablished. Objectives. To identify sputum microbiome characteristics associated with marker of COPD in participants of the subpopulations and intermediate outcome measures of COPD study, spiromics. Methods. Sputum DNA from 877 participants was analyzed using 16S ribosomal RNA gene sequencing. Relationships between baseline airway microbiota composition and clinical, radiographic, and mucoinflammatory markers, including longitudinal lung function trajectory, were examined. Conclusions. In spiromics, baseline airway microbiota features demonstrate divergent associations with better or worse COPD-related outcomes. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Kinetics of beta-2 microglobulin with hemodiafiltration and high-flux hemodialysis. Background. A kinetic model for beta-2 microglobulin removal and generation was used to explore the impact of adding hemodiafiltration on predialysis and time-averaged serum values. Methods. The model was tested on data from the HEMO study and on a sample of patients undergoing high-flux hemodialysis. The impact of hemodiafiltration on beta-2 microglobulin levels was evaluated by modeling 4 randomized studies of hemodiafiltration versus hemodialysis. The impact of residual kidney function on beta-2 microglobulin was tested by comparing results of previously reported measured data with model predictions. Conclusions. A two-pool kinetic model of beta-2 microglobulin yielded values of reduction ratio and predialysis serum concentration that were consistent with measured values with various hemodiafiltration and hemodialysis treatment regimens. Here are the articles from Kidney International Reports. Endothelial dysfunction biomarkers and CKD incidence in the regards cohort. Introduction. Chronic kidney disease, CKD, is only partly caused by traditional risk factors. Endothelial dysfunction is common in CKD and may contribute to CKD incidence. We studied the association of circulating biomarkers reflecting endothelial dysfunction with incident CKD. Methods. The reasons for geographical and racial differences in stroke regards study is a prospective cohort of 30,239 Black or white adults, aged greater than or equal to 45 years. Baseline levels of intercellular cellular adhesion molecule 1, VCAM1, vascular cellular adhesion molecule 1, VCAM1, factor VIII, FUI, and E. Selectin were measured in 3,300 participants without baseline CKD or albuminuria who attended a second visit 9.4 years later. Kidney outcomes were incident CKD, estimated glomerular filtration rate, GFAR, less than 60 milliliters per minute per 1.73 square meters, and greater than or equal to 40% decline or onset of new end-stage kidney disease. Incident greater than or equal to 30% EGFR decline, and incident albuminuria, albumin to creatinine ratio, ACR, greater than or equal to 30 mg/g. Sequentially adjusted logistic regression models assessed the association of biomarkers with kidney outcomes. Conclusion: higher concentration of ICAM1, VCAM1, FUA-E, and E-selectin were associated with incident CKD and greater than or equal to 30% eGFR decline in a large cohort study. Higher FUA-E was also associated with incident albuminuria. Global validation of a model to predict reduced estimated GFR in people with type 2 diabetes without diagnosis of CKD. Introduction: a minimal resource model for predicting reduced kidney function among people with type 2 diabetes and no diagnosis of chronic kidney disease, CKD, stages 3 to 5, was previously developed in a UK population to pre-screen for undiagnosed CKD. This study aims to evaluate the performance of the model on a global population and assess its adequacy with and without regional adjustment. Methods: a retrospective observational study was performed using data collected from the ICRE-ME Global Registry, NCT 0354974, and the Discover study, NCT 023-22762, and NCT 022-26822. Patients were grouped by their World Health Organization classified region. An estimated glomerular filtration rate, EGFR, less than 60 milliliters per minute per 1.73 square meters, was the marker of reduced kidney function. A regional intercept recalibration was applied to adjust for regional variation. Discrimination and calibration were evaluated for the UK developed and recalibrated models. Conclusion: the regional adjusted model demonstrated adequate performance globally. Incorporating the model within practice could help clinicians to risk stratify and prioritize patients at high risk. This could enable improved efficiency via risk-tailored screening, particularly in lower middle-income countries, LMICs. Prognostication after dialysis withdrawal. Introduction: dialysis withdrawal represents an increasingly common cause of death in patients receiving kidney replacement therapy internationally. Prognostic information about stopping dialysis guides clinicians counseling patients and families regarding end-of-life care. However, few studies examine prognostication after withdrawal. We aimed to determine median survival time after withdrawal of dialysis, and to determine which patient and dialysis-related factors are significantly associated with prognosis. Methods: this retrospective cohort study used registry data. We included all adult patients from the Western Renal Services who were receiving peritoneal dialysis, PD, or hemodialysis prior to death, whose cause of death was documented as withdrawal from dialysis, and whose date of death was between January 1, 2016, and June 30, 2022. Demographic, clinical, and biochemical data was extracted. The primary outcome was time to death, defined as days from last dialysis session to date of death. Results: median survival time from last dialysis to death for the PD group, N equals 53, was 4 days, interquartile range, IQR, 3 to 10 days. Not significantly different from the hemodialysis group, which was 6 days, IQR, 2 to 11 days, P equals 0.72. For PD, the only variable significantly associated with survival time was reason for withdrawing, P equals 0.01. Median survival time was significantly longer for patients withdrawing for psychosocial reasons compared to those withdrawing for other reasons, P equals 0.002. For hemodialysis, N equals 186. Variables significantly associated with survival time from last dialysis to death was reason for withdrawing, P equals 0.001. Urine production at the time of withdrawal, P equals 0.005. Serum sodium, P equals 0.02. And smoking status, p equals 0.009. Conclusion. Median survival time was longer for withdrawals, for psychosocial reasons compared to medical reasons. The data presented could inform withdrawal discussions regarding prognostication and end-of-life planning with patients and family. The efficacy and safety of reduced-dose oral methylprednisolone in high-risk immunoglobulin A nephropathy. Introduction. The therapeutic effects of steroids in immunoglobulin A nephropathy, EGAN, global, testing, study, reported that methylprednisolone reduces the risk of major kidney events in individuals with EGN at high risk of disease progression compared to supportive care alone, but is associated with increased serious adverse events, SAEs, primarily with full-dose therapy. The risk-benefit balance of the reduced-dose methylprednisolone regimen is examined in this pre-specified analysis of the reduced-dose cohort of the testing trial. Methods. Between 2017 and 2019, patients with IgG gene, proteinuria greater than or equal to 1 GD, despite 3 months of renin-angiotensin system blockade, and estimated glomerular filtration rate, eGFR, 30 to 120 milliliters per minute per 1.73 square meters were randomized to reduced-dose methylprednisolone 0.4 mg/kg/d or placebo. The primary outcome was a composite of a 40% eGFR decline, kidney failure, or death due to kidney disease. Conclusion. Reduced-dose methylprednisolone is effective in improving kidney outcomes in high-risk IgG, AN. However, it is associated with a modestly higher number of SAEs compared to placebo.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.